Hello, this is Dr. Wright. This is part of the Lung Pathology and Easy Bites series. This section involves discussion of granulomatous inflammation, and this specific session involves the granulomata, which are predominantly airway associated. The learning objectives, therefore, are to develop a differential diagnosis when the airways are airway associated, and to see examples of the entities of this pattern. The differential diagnosis of airway-associated granulomata is quite widespread, and this shows the importance of a very good history. When one finds airway-associated granulomata, consider aspiration, consider infections, tuberculous and non-tuberculous mycobacteria, consider inflammatory bowel disease, usually Crohn's disease, but also ulcerative colitis. Consider immunological reactions, allergic bronchopulmonary aspergillosis, and hot tub lung. In hot tub lung, the reaction is against non-tuberculous mycobacteria. And consider hypersensitivity pneumonia. Hypersensitivity pneumonia usually has a parenchymal component rather than being completely confined to the airways. These are some examples. In this case of aspiration, the airway, as can be seen here, is distorted by the presence of granulation tissue and non-necrotizing granulomata. See here the multinucleated giant cells. When one makes a diagnosis of aspiration, you're looking for plant material, such as found here, meat material, such as found here, and crystalline material, such as is found here. It's handy to lower your condenser because plant material and crystalline material are both refractive. This is an example of inflammatory bowel disease related airway granulomata. In specific, this is Crohn's disease, but occasionally ulcerative colitis can show the same pattern. Here, the granulomata are poorly formed and show focal necrosis. They are really distorting this airway to an extreme degree. This is an example of infection. I've chosen to illustrate tuberculosis. Here's a relatively well-formed granuloma, which is protruding into this airway lumen. And on this section, the granuloma is associated with a marked degree of necrosis. In this section, the airway has been completely destroyed by the presence of this necrotizing granuloma. See the necrosis here in the center. This is a case of hypersensitivity pneumonia, where the poorly formed granulomata are more numerous than one normally finds in hypersensitivity pneumonia. This is what one usually finds, which is present of a rather poorly formed granuloma, maybe a few multinucleated giant cells present in the wall or adjacent to the wall of the airway. Here's an example of an immunological reaction. This is bronchopulmonary aspergillosis. In this gross specimen, there's a large mucus plug and an area here of bronchocentric granulomatosis. The bronchocentric granulomatosis is illustrated in this photomicrograph, where the airway has been completely destroyed and the wall is formed of this palisade granulomatous reaction with central necrosis in the center. If you do silver stains for the identification of fungi, please remember that the aspergillus is destroyed and can be very sparse, requiring staining of several sections because this is an immunological reaction against the fungal organisms. This is a case of hot tub lung, which is a hypersensitivity reaction against non-tuberculous mycobacterium. Here again, the granulomata are rather poorly formed. There are numerous multinucleated giant cells and focal areas of necrosis. So the learning points of this session were to identify the various entities which can have a prominent airway component of granulomatous inflammation. And here are your questions. Question number 1. The answer to question number 1. Question number 2. The answer to question number 2. Thank you. I hope you've enjoyed this session on granulomatous inflammation involving the airways, and as always, your comments are gratefully received.